Hello, good evening everyone. Today we are going to discuss about COVID reinfection. So, what is COVID reinfection? We have been in this COVID pandemic for over 1 year time, and at this point last year we were thinking that the pandemic was going to end itself by 2021, but unfortunately we are here in August 2021 and we are still in the middle of this pandemic. As of now we are still in the second wave, and there is a high chance of incidence of third wave, which is not yet declared as a third wave, but yes, we will be having a third wave, a fourth wave, and so on. So thinking about COVID reinfection or discussing about COVID reinfection is very important at this point of time. So what is COVID reinfection? COVID reinfection is when a person has a significant symptoms which was at the beginning of the pandemic or any time before this time period, and when they have been tested and they were found to be COVID positive, that would be their first COVID infection. And once they had a negative result following this infection, and if they had similar symptoms again, like the symptoms are same, like running nose, sore throat, or cough, or shortness of breath, and they are tested again, and this time if it is tested positive, then that person is said to have a COVID reinfection or a COVID which has infected them a second time. Initially, we were thinking that the effect of the COVID antibodies would last at least for 5 to 6 months, and there was significantly less chance of infection during this time. But unfortunately, it's not true. There have been lots and lots of cases with COVID reinfection, and sometimes even in a matter of one single month. But what to do with these people? Do we treat them again, or will the immunity which they developed during the first phase help with the COVID reinfection? Let's go through these points now. So how to treat these individuals? These individuals should be again taken care of like an independent COVID patient, and we treat them according to the symptoms again. So for mild symptoms, they will be like OP treatment with simple paracetamol and supportive antibiotic if we think that there's a possibility of secondary infection, and then symptomatic treatment. For moderate, also we would go with symptomatic treatment, and for severe cases we would again admit them and treat them like we did in the initial COVID phase. So how many of you or how many of us can get a COVID reinfection? Unfortunately, we do not have a good indicator for this. Anyone can be reinfected, so it's always very important to carry the safety measures, like always wear the mask, and just because you got COVID doesn't mean you won't get it again. You just have to be as careful as a patient who has not got COVID at all. But the good news is most of the reinfections have been very mild, and there have been very few reported cases of very sick COVID reinfections. And then there are lots of questions which people would like to have answers to, like when to get the vaccines after you get COVID. As of now, the government recommendation is to wait for 3 months after your COVID to get a vaccine. And if there is a COVID reinfection, again you would wait for 3 months to get your vaccine shot. There are lots of people who have had COVID and have had one shot of vaccine and then got a COVID reinfection. So what to do now? You wait for the 3 months period again and then get your second vaccine shot. All in all, if you have a COVID reinfection, it means it is an active COVID, and you always have to isolate for the 15 days at your home, and there is always high chance of you spreading the infections to your family members. And coming to the positivity rate, there are very few cases who have been persistently positive, like they got COVID and even after 1 month they are still RT-PCR positive. These people are said to have prolonged infection, and we do not have proper studies about what to do with them. These are not reinfected patients, but these are patients with prolonged COVID infection who have a long positivity rate. Till now, we do not know what to do with them, but the best measure is not to treat them, and most probably we think that they may not be highly infectious to the rest. So, when you are thinking about COVID reinfection, it is very important for people in healthcare sector, nursing staff, and people who are working attached to a healthcare system. These people are at higher risk of getting a COVID reinfection, so they definitely have to follow more safety protocols compared to the rest of the population. And now we have newer medicines to help us fight these infections. So there is a formulation called antibiotic. There is a new formulation where we can give antibodies in the first 3 to 5 days to help prevent the progression of the COVID to a more severe COVID, which is known as an antibody cocktail, which could be tried only if there is no lung involvement. So getting a COVID test in your initial days of having a running nose or cough or fever is very, very important, as you can get this antibody can be prevented. So coming back to the original COVID reinfection, let me just brush up. Anyone can get COVID infection even if you've had COVID once, even if you've had your first shot of vaccine, even if you've had the second shot of vaccine. The risk of COVID still exists as long as the pandemic is there in the society. And with the new variants like Delta variants, the risk of infection is definitely more, and the risk of reinfection is more as long as the virus keeps mutating itself. So always take care, be safe, wear your masks. Thank you.